Welcome to YouTube channel Ramesh Kaila. In our session, we just discussion regarding the BSc Nursing SEM Educational Technology. Some important question of educational technology. Previously, we already discussed regarding the pragmatism, idealism and assessment. If you have not seen this video, please see and remember it. It is very important question for the examination point of view. And in this video, we just discuss regarding very important question. Define learning 2 marks. List out principle of learning 5 marks. And discuss about step in curriculum development 8 marks. First of all, the definition of learning. Learning is sum total of knowledge, habit and attitude. As we know, the learning, it is the total of our knowledge, our habit, our attitude, and that's called the learning. As we know about the learning process, that first of all I observe, then I experience and I do, and that is produce the learning. It is involve new way of doing thing. If you do something, then you must have to learn it and adjust new situation. If you do something, if you adjust in a new situation, it is also process of the learning. It is necessary to satisfy the interest and achievement of goal. Though this is the definition of the learning. Learning is a sum total of knowledge, habit and attitude, and involved with the doing thing and adjust in a new situation. And it is also important for the satisfy our interest and our achieve our goal. So it is the definition of the learning. The learning defined so many educational philosophers and psychologists. Crow had defined the learning, that the learning is a key process of the education process. Learning is very important in the education process. By this process we learn all the things. It is necessary for all education process. Learning is very necessary in all education process. Learning play it is necessary for all education process. Learning play important role in our language. Learning play important role our custom and beliefs. Learning play important role of improve our behavior. Learning play important role to change our behavior and attitude. And as we know, the learning is sum total of our knowledge, habit and attitude. Learning is important for the satisfy interest and achieve our goal. So now if we define the learning, then we must have to remember anyone, our educational philosopher. In our definition, we remember the Crow had defined the learning, that the learning is key process of the education. Learning is all process of the education. Learning play important role. The role of the learning, we have to write the role of the learning, that it is important role in our language, our belief, our custom, our behavior, our attitude, our habit, our knowledge. It is also satisfied our interest, and it is also important for the achievement of our goal. So it is in definition of the learning. The principle of learning are under. The principle of learning is the learning is a actively process. It is actively process. It is continue process. It is educational process. It is knowledgeable process. It produce habit. It develop our attitude. It is the principle of learning. The learning is actively processed. Learning constructing knowledge. Learning is constructing meaningful knowledge. Meaningful because once teacher teach any type of the activity, it is all activity are meaningful. So learning constructing the meaningful knowledge. Learning creating experience by doing any experiment, by doing any activity. In our clinical experience also some learning is give the experience to the student or learner. Learning always enhance knowledge. Learning always enhance our knowledge. We give the wide space of the knowledge. Learning always provides social environment because the social environment is the one of the best tool of the learning. Learning must be continue. It is continue. Learning must be make a learner capable and successful. If we learn something, then we capable for the successness. Learning reflect, regret, integrated part of the learning. It is integrated part of the learning. If we learn something, then we learn all the things. So it is the principle of learning. Learning principle is very easy. If you remember for that the definition, then you able to write the learning principles. To discuss about the step in a curriculum development. So it is the third part of the question and 8 mark. The discuss about step of curriculum. As we know what is the curriculum, how to curriculum plan, what is the good curriculum, role of the teacher in a curriculum. There are so many important questions in the curriculum, but here we discuss just the step of curriculum development. Then the step of the curriculum development are under according to Ralph Taylor. There are 4 steps of the curriculum development. The first step is formulation of education objective. If we want to develop any curriculum, first we develop the educational objective. Why we develop this curriculum? Which type of the education we want to give the learner or student? It is the objective. Then select learning experience. And learning experience is very important because if we want to teach the student about the injection, intramuscular injection, then we must have to select learning experience like the demonstration, how to give injection. So it is the learning experience. Third one, organization learning experience theory and clinic. So when we decide that our learning experience is in a clinic or is in a demonstration room, first must have to in a demonstration room, then we put in practice in the clinic. And in the third step, the organization of the learning experience, first we teach the theory to the student and then we teach the practical in a demonstration room and then we put in practice in a clinical. It is the third step of curriculum development. And the last and fourth step is the evaluation of the curriculum. As we know the assessment, as we know the evaluation is must in a curriculum development. If we do not evaluate the student, then we don't know that the student either learn or not. The curriculum development is the step-by-step process. Design, improving the course at a school, college, university, everywhere the curriculum is needed. Whatever, if it is school, if it is college, if it is university, if it is organization, the curriculum is must. Institute must have curriculum committee. There should be a curriculum committee, and curriculum committee is finalize the curriculum. and approval the curriculum, and afterward the how to evaluate the curriculum, it is also implemented by the curriculum committee. Then we just discussed all the steps in details. First of all, formation of the educational objective, how to form educational objective, the formulation of the educational objective including following thing. First, we must have to write the philosophy of institution, our philosophy, the institutional philosophy, which type of the institutional philosophy is there, that we are think that the student are able to do any work in a clinical area. It is our philosophy. Objective of the institute, aim of the institute, need of the student, need of community and society, level of the student, available resources, criteria of educational process, criteria of selection learner, criteria of evaluation, preparation of main objective, preparation of contributory objective. It is the objective step. First must have to format our philosophy of institute, objective of institute, aim of institute. Then if we plan curriculum for the BSc nursing, then we must have to evaluate the need of student, need of community, need of society, need of healthcare system, and then the level of student, which level students is there. If the BSc means if it is 12th science student, then the level of student is 12th science. So science student must have learn this type of the nursing in the BSc nursing. Available resources, like available resources means the tutor, means demonstration rooms, clinic, community area. There are the available resources. Criteria of educational process, which type of the process, lecture, demonstration, multimedia, use of the multimedia projector, criteria of selection of learner, how to select learner by the formative examination, by the summative evaluation, by the formative evaluation, criteria of the evaluation. It is also by the summative, by the formative, by the interim. Preparation of main objective. Then we must have to prepare main objective, that the end of our education student must be learn this, and he or she able to do this. And the preparation of the contributory objective means in a minor objective is there, cover all the topics in the contributory objective. The second step of the learning is select learning experience. As we know, the learning experience, which place student gain the learning experience. According to course content, select the learning experience as a follow: classroom teaching, demonstration, field visit, clinical teaching, and self-study. So these are the learning experience, learning content. Third step is organization of the learning experience, theory and clinic. According to course content, select the learning experience like clinical experience. In a clinical experience, we must have to visit our Anganwadi. Then and then we see that the below 5-year children who is malnutrited, who is in undergrade. So all the activities we are visited. If we learn, we are visited in a Anganwadi. Rural experience, home visit, special clinic like maternal, leprosy, cancer, TB, etc., diabetes. Then the fourth step of the evaluation is evaluation of curriculum. In the last, we learn all the things to the student, but student is gain knowledge, information. We must have to check it, and for the checking, we must have to evaluate our curriculum by the assessment doing lecture, by the question answer, by the unit test, by the term test, by the model test, by the final test, practical examination, viva. though there are the four type of the curriculum of evaluation. So it is the fourth step of the evaluation and evaluation of the curriculum, and last one is the fourth type of the curriculum evaluation. One is the placement evaluation. Placement evaluation means if we visited an Anganwadi, then on the spot we take the student and evaluate the student, see which grade is present in this child, see if it is dehydrated or not, see it is anemic or not. It is the placement evaluation, formative evaluation by the question answer, by the test, by the MCQ, with the question. Diagnostic evaluation, as we know in a previous lecture, we must have to diagnose that, we must have to questionnaire to the learner. And last one is summative. The total evaluation is that in a summative evaluation, and teacher must make the frame structure for the evaluation. So it is the topmost question of educational philosophy, educational technology. Define learning, list out the principle of learning, and discuss about the step of curriculum development. I think it is too easy for my dear student. If you feel better by this listen this video, please comment. Thank you very much.